we're all trying to anti-age. The whole goal here is to live optimally till the end. So let's talk about what is aging, chronological versus biological age, and does it even mean anything?
Yeah. So chronological age, that's easy. Most people know how many birthdays they've had. That's their chronological age. That's not what is important, though. Biological age is what matters. We all know 80-year-olds that look and perform like they're 60, or 40-year-olds that look and perform like they're 60. So biological age is the number one risk factor for every chronic disease. It's interesting if you look at what increases our risk for cancer and heart attack, all of these things. We know smoking, obesity, these things do, but they pale in comparison to age. So if there's a way to actually decrease your biological age or slow down your rate of aging, we should do that. We actually take a very serious approach to that, and we actually measure biological age and pace of aging through epigenetic testing, through DNA methylation and epigenetic testing. And that way, you can't really dial something in and make an improvement on it if you're not measuring it, if you don't have an objective measure. So, for example, we use something called the PACE test. This was developed by Duke, and it tells your rate of aging. So it gives you a score from like 0.6 to 1.4 on how fast you're aging. 1.0 is average. And the cool thing about this test is it's very sensitive to intervention and change. So, for example, if you get pregnant, which is a physiologic stress, your rate of aging goes up about 20%, but then it comes back down when you deliver. Or if you get COVID or get in a car accident or have hip surgery, your rate of aging goes up and it comes back down when you recover. So what this means is it allows us to do these N of one experiments with patients to see what reduces their rate of aging. So Stanford did this study where they switched people back and forth between omnivore and vegan diets and looked at their pace of aging. And you could see changes in pace of aging in those 8 weeks. So you could, if someone wants to do a carnivore diet or wants to do a vegan diet or wants to do a keto diet, you could do this pace of aging test and then repeat it after 8 weeks and see how it's affected your rate of aging. Or if someone wants to do whole body IV stem cells or try some new supplement regimens or try rapamycin or some other longevity compound, they can do this test before and after and get an objective measure. And if you do these experiments kind of a quarter at a time every few months, you can slowly dial in the things that most optimize your rate of aging, which is the goal. And we frequently will see people take the rate of aging down 10% or even sometimes up to 20%. And if you reduce your rate of aging by 20% over the next 50 years, you've added 10 years to your health span. So that's a tremendous benefit. So we really try to dial in that rate of aging and have an objective measure for it.
It just makes sense, right? And you hear people out there say, well, we can live till 150 now. Not that we want to in this chaotic world, but having that quality of life later in life. And I look at some grandparents in my family that are bedridden, and then I will be out on a hike in Idaho and I'll have these 80-year-olds pass me because they're so fit. So which one do you want? And it's what we're doing today that is going to affect our later years.